The young lady responsible for this panel, who spent nearly a decade evaluating products in her father's cosmetic testing labs, which I guess just goes to show what happens to keep you young and beautiful when you spend a decade in the lab. I find that real hard to believe because she looks so young and gorgeous, you know. She's published numerous articles for the industry, the trade industry, and I just found out that she's currently president of her own skincare line, Country Glow Cosmetics. Now, seeing as she's from my home state of Pennsylvania, I can see where she got that wonderful name for her new cosmetic line. And she is the editor of Advanced Professional Skincare Textbook. She's a dynamic personality in her own right. Please welcome Patty Puglisi.
Thank you. In the mid-'80s, however, a new angle was taken by industry in response to the more educated baby boomer yuppie living kind of a fast life, and that fast life was beginning to show up on their skin. So words like active ingredient and clinical studies show that began to show up in the advertisements. Words like skin treatment product came into the vernacular, and that's where the trouble started. The FDA's position on Dr. Schlissel. Well, I think we've about disaster-proof the afternoon. We had a speaker not show up, we had one almost go through a chair, and we had one erroneous introduction. I think things ought to go smoothly from now on. Getting back to that cute comment I was about to make about this fellow that used to help me with my homework. This speaker was able to join us for a very specific reason today. Last year he was on the panel and we discussed a textbook, an advanced skincare textbook for the esthetician in an attempt to try and bridge that gap between aesthetics and medicine or dermatology. You're going to have a much greater chance of getting a plastic surgeon or a dermatologist or someone within the medical community in your town to trust you and refer their patients to you if they believe that you have made an effort to try and understand some of what they're about instead of just being mad because they don't understand what you're about. It has to go both ways, and this textbook is a step toward that. It will be available for publication in February. Everything takes longer than it takes, and this took a little bit longer than we thought. It's been my privilege to work as consulting editor on this book, but the fellow that wrote the really good stuff is with us now. Please welcome Dr. Peter Puglisi.
Thank you. I wish to speak mainly about education, and Pat mentioned bridge building. Being a former seminarian, I'm still pretty much imbued with my training, and one of the names for the Pope is the Pontifex Maximus, and Pontifex really means bridge builder. When you pontificate, you're not really preaching, you're building a bridge. To build a bridge, as most of you know, you have to start on both sides of the river, or both sides of the canyon. I'm trying to start now from the medical side, trying to incorporate concepts that you will understand, in not in layman's terms, but in true medical terms, but I'm also at the same time trying to translate your terms into those medical terms. We mentioned last year about asphyxiation. You say asphyxiation to a medical doctor and he thinks the patient is dead or close to it. He doesn't understand those. He doesn't understand the word cuperosis. He doesn't really understand congestion, and in terms that you understand skin. Now, this is what I want to propose to you. The book that I'm writing is just about finished. I have 2 more chapters to go that really are going to require your help. Yesterday, I was extremely pleased to hear one of the estheticians ask Dr. Kligman about milia in terms of post-op and pre-op care. That's a very profound finding, and it's to that young lady's credit that she was astute enough to pick that up. Pre-op and post-op care now is where I need some help from you. I'd like if you would just simply write in your experiences and cases and techniques on pre and post-op care, so I can incorporate that into the chapter on preoperative and postoperative care for the esthetician. We need also, currently, in the educational system for estheticians, a tremendous revamping. Going over the legal ramifications of education, I find in some states there is no requirement for training to be an esthetician. Other states require 2,000 hours. We've been fighting to get the approved course in Minnesota increased to 1,000 hours. For some reason, the licensing bureau doesn't see the necessity to do it. But I'm designing courses now that will fill the gap in basic science. I'm talking about histology, microbiology, skin anatomy, physiology, and of course advanced treatment courses. We're trying to develop around the country liaison with dermatologists, with plastic surgeons, cosmetic surgeons, and also with university hospitals and their aging programs. This will be your internship. It's there, but we need the input coming back from you. None of us can do this alone. We need the feedback, we need the cooperation, and had some discussions with Mark on this from the NCA, and I think that's the organization we really should work with. I'm very pleased that UNESCO has the criterion, which should be universal, and I think then we can really move osteology to a very high level. Keep in mind one thing: you are not ever going to be doctors. If you want, you can do that, but it's 9 to 12 years of labor. You can make that decision. But you can be physician assistants, you can be ancillary servants in the whole field of beauty and skin care, and you can have a very satisfying and very rewarding life. The amount of knowledge that you have has nothing to do with the letters after your name. One of the sad commentaries that I have seen in education is that many of you have practiced for 20 years, as have physicians practiced for 20 years. But it's actually 1 year of practice repeated 20 times. Without postgraduate education, you're never going to get anywhere, and you will be, rather unhappy in the profession. As I talked with Dr. Kligman, he was one of my teachers when I was a medical student. He is even more enthusiastic teacher now than he was as a student, and he was extremely enthusiastic then. I believe that kind of attitude, that kind of drive is really what we need. And it's your observations and your interest and your cooperation with medicine and with podiatry, with the subspecialties of medicine, I think that's going to move this whole industry far ahead in the future. Thank you.
Okay, at this point, I'm going to introduce Dr. Legrand, who's going to come up and lead off the questioning. The rest of you who have prepared questions, find a mic, line up. I not only suggest, I insist, as I must, that you keep your questions brief, to the point. Please introduce yourself by name and company affiliation. If you have a speaker in mind that you want to answer the question, please specify that as well. Otherwise, I'll just pick one. Dr. Legrand?